Hi, today I'd like to talk a little bit about the confusion surrounding whether or not antidepressants are effective medications. In other words, do they work? Now, they are very popularly prescribed medications for both depression and anxiety. I'm talking about the serotonin based antidepressants mainly. And they are, as I said, very commonly prescribed, taken by a lot of people. And yet, what you hear in the media is that there's a big question as to whether they even work. And I want to talk a little bit about why there is any doubt about this. Now, I think one aspect of it is that people tend to take anecdotal reports and assume that they represent all the many, many drugs in this class, and the idea that what they happen to hear about or read about as a patient or a few patients' experience is reflective of the experience of most people, or maybe even everyone who takes the drug, and that's far from the truth. So, and I think the other aspect is that the medications may not be taken properly, so the idea that they don't work is related to the fact that they haven't been taken for long enough at the right dose, and not really related to the fact that the medication doesn't do what we hope it's going to do. So the vast majority of antidepressant prescriptions are written by non-psychiatrists. And that's not necessarily a bad thing because not everybody has access to a psychiatrist, or sometimes people, because of stigma, choose not to consult a psychiatrist. So the fact that people can get prescriptions for these medications that can be very helpful is overall a good thing, except for the fact that in those contexts, the primary care doctors who write the prescriptions don't necessarily have the time to explain and emphasize the need to take the medications for 8 to 10 weeks before we know whether or not they work. So what happens is somebody goes in, reports that they're having some symptoms of depression or anxiety, and their well-meaning primary care doctor gives them a prescription, but the message that they have to take it for 8 to 10 weeks doesn't get across. So people take the medication for a month, they don't feel anything getting better, and they assume the medication doesn't work. Then from there, they go forward telling people that they did try an antidepressant and it didn't work for them. And this builds this reputation that the medications don't work, when in fact, if taken properly, it's certainly possible that the medication may have been helpful. So I think that's a big reason why there's this idea that medications don't work. I think the most important thing and the takeaway is that given the safety profile, given the effectiveness overall, for most patients who are suffering depression and anxiety over an extended period of time, meaning more than just momentary depression or anxiety, it's going to be well worth a try of medications. And it's important to do it with a prescriber who knows the details and can make sure that the medications are taken properly and for the appropriate length of time, because that's what's going to make sure that they do work. And they don't work for everybody, but they do work for the majority of people. Depending on the study you look at, anywhere from 2 out of 3 to 3 out of 4 people will benefit from an antidepressant medication, and that's both for depression and anxiety symptoms. So I think that that is the takeaway. Thank you.